My name is DeGheest. I first started over 30 years ago as a medical device entrepreneur, and I launched pulse oximetry for a company called Nellcor. Then I was involved in other companies like Aspect Medical and Massimo. And then I got the bug for really creating a new space called HealthTech. And I coined the word HealthTech to differentiate from MedTech and biotech. And the idea is that how can we use technology from the computer and telecommunication world to change workflow and healthcare delivery. And as a result of that, several companies you may be familiar with emerged that I helped start. One was a company called Pyxis, which changed the way we dispense medication in hospital setting, which is in most of the hospitals in the US. Another company called Omnicell, and then Omnicell did the same thing on the supply side. And then really the first granddaddy of digital health, a company called VisiQ. And VisiQ was started from Johns Hopkins by two physician intensivists from Johns Hopkins. And they really beamed out all the vital signs in the ICU into a remote location. So we could use the concept of the air traffic controller to remotely manage 50 to 100 patients 24/7 by intensivists. And in the process of that, I really became a mentor capitalist, which is not only was I part of the executive team in the early days, but I really became more like an investor and a mentor to the young entrepreneurs, several of them being doctors. I started this group called HealthTech Capital in 2010 with the idea that you really need three sets of expertise to change healthcare. The first one is understanding healthcare, and that means the clinical workflows, where does the physician fits? It's still healthcare delivery, people forget that. The FDA, the reimbursement, and all the challenges of how the healthcare system works. The second aspect is understanding technology. It's not necessarily to put something over a mobile phone, but use mobility as a way to change a business models and how we deliver healthcare. And the third aspect is changing behavior. If you think about it, in the past, the medical device industry was developing products for the super user. And the super user was the physician. We didn't have to train them. They knew exactly what to do with it. We were physician-centric, and most of the technology were based on material science. This world is exactly the opposite. We are basically based on information science, and we're really focusing on being more patient-centric. And what I mean by that is we need to enable the patient to take charge of their health. And really that means we have to get them to change behaviors. And that's something that historically we never really spent that much time on as an industry. So these three sets of expertise, really nobody had them together. So we created a group of around 100 people who are coming from different sectors. A third of our members are physicians. And so we have deep clinical expertise there, but we also have accredited investors who come from the medical device and biotech side. We have venture capitalists, and we have some of the leading industry players like Johnson & Johnson, Philips, Adidas, Merck, and companies like that. So 3 years ago, there was really a revolution that happens with the world digital health that came out after we started this group. And one of the worry we had is that there were a lot of digital health incubators that got started. So you had these conferences there where companies were really having a 59 seconds of fame. They were showing what I call a shining object or prototypes. And then they will come to us and we would ask the question, say, what's the pain point? Where does it fit in a clinical workflow? How are you going to validate there's value here? Who's going to pay? And will they use it? And so we got really tired of some of these issues there because there was really a bubble that started that in digital health. And we started our own conference called the HealthTech Conference. And this is now our third year. The HealthTech Conference is going to be on October 14 and 15 in San Mateo, California. And what is unique about the conference is that we really are talking with the existing players of healthcare. And these are the payers, the providers, the physicians, and the self-insured employers are now moving in. And we talk all together about how we're going to lead the change of healthcare. We want to take the ownership of changing healthcare instead of waiting for people from the technology side giving us the technology. So the conference is unique in the sense that we're focusing on how do you build sustainable businesses in the existing healthcare ecosystem. So that's October 14 and 15, where we have entrepreneurs. We have some of the leading people who have built companies in this space who are going to share their expertise and what it takes to win or not to win. And of course, we have most of the leading investors coming in there. So as physicians, I highly encourage you to be there because we need your voice to basically drive the leadership in how we change healthcare.